Welcome to the Asking Why podcast. I'm your host, Clint Davis, and I'm glad to be back with you guys. We've had a couple weeks off. We had some canceled podcasts, so sorry about that. As you, I know, just anxiously sit around to listen to us talk about stuff. So thanks for texting me and emailing me and asking me where the next episode is. Here it is. Today we have a good friend of mine, a church member, somebody who I love very, very much, her and her family, her husband, John, and her kiddos, Kayla Kinnebrew. Psychiatric mental health nurse practitioner. Did I say all that right?
You got it.
There we go. Kayla, thanks for coming on the podcast.
Oh, thanks so much for having me.
Absolutely. So tell us a little bit about you. I mean, I know a lot, but tell the listeners you. We're going to talk, just to give you guys a heads up. So she is working at our practice now. She has her own practice within our practice, and we're referring back and forth with each other. And you guys know we've probably had a few of nurse practitioners come in and try to do this, but Kayla has got some clients. She has jumped off to a good start and is being busy. So tell us a little bit about your story and what led you into kind of doing what you're doing.
Yeah. At a really young age, I think like my early teens, I had a passion for sitting with people and hearing their stories. Mm-hmm. Some of my older cousins, family members, friends, like I was the person they would come to.
Right.
So that's kind of where it started. And then I went to school, went into nursing, and I had a really great psychiatric rotation at Louisiana Tech. Mm-hmm. And I got exposed to mental... How
about them dogs?
Yeah, go dogs. Just a really good rotation. I got to see a lot of like people struggling with anxiety, depression, schizophrenia for the first time. Mm-hmm. And even though I hadn't become a nurse yet, I just knew that I wanted to be in that area mm-hmm. and more on the counseling side. So I was a nurse for 11 years, sorry.
And where'd you do that at?
Here in Shreveport, I did mostly emergency medicine.
Okay.
Wanted to do critical care as mm-hmm. a nurse. I didn't want to be a psychiatric nurse, which mm-hmm. I know that's kind of interesting because I knew that psych nurses didn't do counseling. So
temperamentally, you were just kind of always wired to be that person that people came to with their problems. Yeah.
Yeah.
Yeah. I mean, so many of us, I think, that are in the counseling field. I mean, I think people can become a counselor if they're not wired for it. But I do think that so many of us, like that just has been the thing, you know, for most of our lives, is feeling like, man, I really like hearing people's stories. Do you feel like that came out of a place of wanting to be heard yourself, or do you feel like that was just kind of a gifting?
That's a good question. I definitely dealt with my own anxiety and feeling maybe unheard and alone sometimes. So yeah, wanting to be that for someone else, like not wanting anyone else to feel those negative things that I did.
Yeah, it's interesting that so many of us, whatever we do, get into it because of our own pain, as we talk about with the restoration therapy stuff, which is, you know, God shapes us to where it's like he can make that be a peaceful response, but it usually doesn't start out being the best. You know, it's not, we think it's coming from a place of peace to help other people, but ultimately it's just to help ourselves until we kind of can work through it. Mm-hmm. You feel like that?
Oh, yeah. Maybe twofold. If I didn't have my faith, if I didn't have God, like to pray to, read my Bible, lean on, my story would be a lot different. My anxiety would have taken control. And yeah, if I don't sit with someone and talk through my things, they bubble up and prevent me from helping other people. Mm-hmm.
And as a nurse and then psychiatric nurse practitioner, because that's a very medical driven model, right? I mean, you're working with people who have clinical. So can you talk to me a little bit? I'll obviously put input, but the difference between maybe, we talk about counseling. Some people have feelings they're dealing with. Some people have emotions. They have family systems issues. They have trauma, but we don't always label that as just like a chemical thing. Mm-hmm. But within a nursing field, there's more of a kind of medical model. So how have you learned, or how are you learning to bridge the gap between the two? If that makes sense what I'm asking you. Like as a nurse, you're looking at everything not from an emotional perspective or from what their family, how they hugged them and loved them and cared for them. You're looking at it from like, you have a medical issue, a chemistry issue, and then all of a sudden you have to bridge the gap with psychiatry, and now you're working with like mental health. but it's still almost a medical view.
Yeah. I bring that up a lot when I have new clients. I'm like, I feel almost strange that I genuinely feel that God called me to do this. But the emotional, the counseling side of it is so important to me to help someone work on the root, not just give a medication and move on.
Yeah.
Sorry, there's a lot in there to your question. I'm trying to answer it.
That's okay.
So for me, in school, I didn't learn a lot of how to bridge the gap. It was a lot of how medications work, side effects, what they're approved for, just how they work in the brain, how to augment them if it doesn't work, things like that. And the counseling side, I got to see very little. I was really privileged to come do internship at your office, so I learned there. So yeah, I'm just learning how to do what I'm passionate about, which is like to hear someone's story and work with them within like what's going on with them, what's important to them, what their values are, but also not ignore the medical side if your symptoms are so extreme that counseling's not working on its own. Counseling's not getting me out of the depression. I can't function because I'm so anxious. I think sometimes people need a bridge to fill the gap to help their brain function a little bit better so that counseling can work.
Yeah. That's good.
So, yeah.
Well, I mean, it's a big conversation that I think in 2025 is kind of what is shifting. You know, we talk about this a lot, you and I, but also just our practice. Even the word therapy is a medical term. It started out, psychotherapy is you're treating mental illness. And even that term like illness is more of a like, I call it meat machine. Like it's not really thinking about your spiritual life, right? It's not like what you believe, right? In your mind, what are you thinking? How is that impacting your body? It's all pretty segregated. You know, it's like your heart disease, for example, is the number one killer in America. So what do? We treat it with medication. We tell people a better diet. We, get them on blood thinners. We try to get the plaque off of their heart so they don't have a heart attack. Like we treat all these things, and it really is a medical thing. It's a clinical, chemical, physiological problem. But we also know that anxiety and cortisol and stress, it puts pressure on the heart from an emotional standpoint that then makes that heart weaker and more susceptible to the biological markers causing a problem. And then another level is our relational issues, that we have with not feeling loved and not feeling safe. They make us believe things differently that lead to us thinking differently, which lead to us feeling things differently. And that over time.
Yeah, it changes your neural pathways.
Right. So it's like none of it's actually separated. Like there's a Venn diagram and there's some overlap. But our schools, currently in America, they don't really integrate these things, not just from a spiritual to a medical model, but from when you go to nursing, like you just said, you don't learn a whole lot about any of this stuff we're talking about. So you have to learn it kind of on the fly out in the field.
Yeah, through practicing and training and learning from you or other counselors that I'm around.
Which is kind of scary for the average listener. I'm saying this because I think this is why a lot of people, and we're going to get into this second, have a problem with medication or therapy in general, or they have stigmas to it, because there's so many narratives out there about what is therapy, should you take medication, and then you add on the theological Christian lens in the South, and it's like, well, you don't need medication, all you need is Jesus. And it's like, well, if you cut your leg off, you're not just going to pray about it, right? You're going to go get treated, and you're going to go, get medically taken care of. It's the same way when you have chemical imbalances.
Yeah, I agree with all your points. I think trying to find a balance of hitting it from the medical side, like if there's a chemical imbalance based on what we're seeing in the office through our assessment, is part of that. But without counseling, you're not going to have a long-term, your long-term symptoms they're going to come back. most likely, if you're not also working on like where this anxiety came from. And
yeah, absolutely. I think the question for the consumer is, what are you coming to therapy for? What are you trying to get medication for? And they don't know. They don't even know all the things we're talking about right now. So I think the average listener goes, I'm anxious. I don't like feeling anxious. Someone told me medication will help me not be anxious, so I'm going to go to Kayla and get medication. So to that person, how do you help them? What would you say to them?
It would be a long conversation
sure.
of a history. When did this start? How does it show up in your body? How is it affecting your day-to-day? What things have you tried before? Does anything make it better or worse? Because everyone has anxiety on some level about something, and not everyone needs medicine for that. So that's another thing I bring up in sessions all the time is I believe in using the smallest dose of medicine for the shortest amount of time, and not throwing a lot of medications at once. And I think that's really different than maybe some other practitioners.
Yeah, why do you see it that way?
Several reasons. I don't want you to have a negative, like a bad side effect, or not know which medication is or isn't working. Side effects for sure. And then wanting you to come off of it after you've been in counseling for a while so that you're not dependent on a medication. I want you to learn the things that you said, that you're important, that you're loved, and to kind of heal some of those wounds that maybe have caused some of the anxiety and depression.
So how do you know when it's, because there's some overlap, right? Sometimes it's chemistry and not character. Right? Sometimes there's literally like their body's not producing enough, whatever. Now, that could be from the womb.
Yeah.
But I would say more than likely when you actually take an assessment of somebody's life, most people aren't just born with a high level of anxiety. Would you agree?
I would agree. I think we all have different temperaments and like lean towards more characteristics or reactions to things, but oftentimes someone who has severe anxiety, depression, other things, they've had a lot of stressors in their lives for a long period of time through trauma, just a lot of different things.
Yeah, so they're, the nature that they're born with, there's obviously some brokenness and some predispositions, but then what they experience in their life and their experience of, let's say you have a more anxious child who's 3 or 4 or 5, the parental response to that little bit of anxiety then either validates or invalidates their worth and their value and their security, which then either helps them manage their anxiety or exacerbates the problem. Is that what you're saying?
Yes.
Yeah.
And I think part of what you're asking is, like I said, for the shortest amount of time for medications, that's not possible for everyone.
Right. So some people need to be on medication forever.
For certain situations, yeah. I'm always open to, after a certain period of time, if you feel like you're in a good place and you want to try coming off, I'm always open for that. But I'm also, also really honest about if you've had, for example, if you've had a major depressive episode once, you've been on medication, you come off, it comes back after a few months, you have another, and you do that again, and it happens for a second or third time, then you're more likely going to need something long term.
Right. So some of it is like trial and error, but in a conservative way, so that you're being as safe as possible for the person, so that the error isn't this big, huge dip.
Yeah.
Is that what you're saying?
Yes.
Yeah, that makes sense. Why do you think so many people don't look at it like that? Like, why is it so easy for parents who have a kid or a teenager who has this symptom, an anxiety or depression that maybe they haven't paid attention to? Now it's really bad, and now they're calling us and saying, hey, we need to get them in. They're suicidal, they're depressed, they're anxious, and we need meds. You know, why do you think that the average maybe doctor, or, you know, that large majorities of people out there, even primary care physicians, they just give medication without doing all these things that you're talking about? Like, how has that become such a problem in our culture, or do you see it as a problem?
I do think, sorry, I'm losing my voice this morning. Yes, I think that antidepressants are overprescribed, and I think primary care physicians, they initially want to help. And so they do what they know that they can. And I think that it gets left at that level often because the parents, like, it's probably really difficult to seek help. It is. And so they sought help, got the medication. It's kind of working. We're just going to leave it at that. This is working. This is keeping everything
At bay.
level. And
So
then,
we're good.
Yeah. And so that could perpetuate, probably what's been going on their whole lives, like in their childhood, what's led to this point, instead of dealing with what was causing the anxiety or like keeping it going. Like, we're not going to deal with that. We're not going to change our parenting or what we're doing in our lives. We'll just put a Band-Aid on it. Maybe that's easier in a way.
Yeah, for sure. I mean, I think they don't even know they're supposed to do anything different, because we as the professionals are, especially with like medical care, mental health care, I mean, pastors, people, the average person has no clue what is what, right? They're just living their life. They've grown up in wherever they've grown up, and now they're in crisis, and they're looking to you and me and the pastor just to know everything. And they assume that these conversations that you and I are having are what professionals have in grad school and at med school. And it's like, that's not the case. These conversations are had amongst people in different professional fields trying to look at 2025 America and go, what we're doing is not working. We have access to all the healthcare in the world, all the medication in the world, and yet these people are the most anxious, depressed, wrecked human beings on earth. So something, as a professionals, we have to take responsibility and go, something we're doing is not working. Going to your primary care physician and bringing your child to their pediatrician for medical medicine for psychotherapy, but not going to therapy is a problem, right? So it's like, we have to have this podcast. We have to have these conversations because I think the average parent doesn't have time to do that. They don't have time to research it and look it up. They've got a kid in crisis and they want you to tell them what to do. So that's like part of why I wanted you on here, is like, this discussion is so important for the average person to listen to and kind of, parse through and figure out what's best for them.
Yeah. And I mean, I'm, blessed and happy that I'm here to help when those things happen. But I acknowledge that we should be doing things like as communities and within our families to prevent some of these things happening.
Absolutely. Yeah, I think you're on the end of going, hey, we got to do the best we can with what we have been given. Medication. If you're in a crisis, which goes into like, what do you think a crisis is? I think I was listening to something the other day, and it was just talking about how we're currently in this season with, millennials and Gen Z, where it's like average normal anxiety or average normal sadness is now a medical problem. And then they come and they get, it's like the swing is pulled the other side where they get medication for something that is like a normal thing you experience in life, which then just exacerbates the problem. Or they even go to therapy and they're like, I really need to talk about my trauma from my childhood. And they just marinate in this pain all the time over something that's like, it's what happens to almost everybody.
Yeah.
And so it's like, we're trying to find that balance of, instead of giving general things like everybody needs medication, everybody needs therapy, everybody needs EMDR, it's like, well, let us get to know you and be in relationship with you, and then we'll together figure out what's best for you.
Yeah, that's exactly how I practice.
Yeah.
I purposefully spend a lot of time with my clients, probably more than, I've heard more time than other psychiatrists do. For whatever reason, I choose to practice that way. So I really sit and listen, and I want to make sure that the decisions we're making together fit what's going on with you, and that like I understand your stressors and just know you.
I think for you, what I love about you, Kayla, is like the whole goal of what you're doing is like ministry. It's to care for people. It's to love on people. It's to, show them Christ in your life, and for them to find hope in the right things. And so if it was, I'm not saying everybody's out there to get money, but all of us have to be honest that do we assess our life and go, is what we're doing to make more money? Is it to help more people, or is there a balance of both? And the need is so great that once you get a full caseload, you could sit with people for 15 or 20 minutes and go, yep, here's your script, see you in a month. and make $300 for that 15 minutes. Lots and lots of people are doing that every single day. Now they could say, oh, well, the need's just so great that I don't have the capacity. And I could say, well, yeah, but you're making $600,000 a year doing that. So is it really about that the need's so great, or is it about getting people through very quickly so you can get to the next person so you can, make the money? Mm-hmm. Our lifestyle is going to determine and dictate that. And so for you, the balance is just like it is for me. What do I really need versus what do I want? Mm-hmm. And how does that play into the way we care for people? And I think that's very important that you go, hey, I want to sit with people for 30 minutes or an hour and actually do some counseling with them and then prescribe them medication. And I can kind of have this dual role because that's really the best. That's the lowest risk for people when it comes to the thing that you're doing. Mm-hmm. Does that make sense?
Yeah, you described what I'm trying to do really well.
What's what I see you doing?
Yeah, I plan to not have a large caseload because of my schedule with my kids and my family, but also I want to give everyone the quality of care that they deserve.
Absolutely. Yeah, it makes a huge impact on, you come into the table, into the office with people and genuinely assessing and caring for them and spending time with them because the medication isn't their savior.
Right.
It's very helpful, right? So it feels like there's two categories here. There's the category of people in our society, and I'm just thinking out loud, that are like overly medicated because they're just so dependent on this pill's going to save my life. And then there's a whole group of people who are enabling that. Mm-hmm. But I feel like, is there still a group of people who, within the church especially, are kind of hesitant to medication because they see it as like a lack of faith issue or very dangerous?
Yeah, I don't have anyone in my group of people that I spend time with now who feel that we shouldn't use medication at all or we should only pray about it.
Thank God.
But I grew up in a place where
but we know that exists. We hear it from our clients.
I'm hearing it from clinicians now. A couple of things I posted on my online Facebook platform, and I've just got a lot of thank yous for just saying that it's okay. It's okay if you need medicine. Mm-hmm. It doesn't take away your belief in God or your faith. Mm-hmm. So yeah, I think it's still around.
Yeah, I mean, and that's to be assessed, I think. I think that's part of the scary thing for people is it doesn't always mean that there's a faith issue for sure, but sometimes it is. Mm-hmm. Sometimes our anxiety and our depression is literally a faith issue. It's, I don't believe God loves me. I don't believe he's going to provide for me. The way that people treat me and the way I allow myself to be treated and I treat myself is impacting my cortisol and my serotonin. Mm-hmm. You agree?
Yeah, those are the clients where I'm like, we talk about that. We talk about kind of what's gone on in their past and how they're still reacting based on their past, how that's causing the anxiety. Mm-hmm. And sorry, I'm talking around your question. Yeah. But yeah, we talk about the faith side of it. Is it you're putting your hope in something else? Mm-hmm. And so we have to work on that. But I also assess, has it gotten to a point where you need some medical assistance too while you work on the faith side? Well, it's both and. It's kind of the chicken or the egg. It's like, what started this? Well, it matters, but it doesn't really matter when you're in crisis. Mm-hmm. And I think that's what people can get from let's say an unhealthy biblical counselor or a pastoral care is somebody comes in with anxiety, they're having panic attacks, and their first modality is going, they're like Job's friends. What'd you do? What have you done wrong? What sin do you have in your life? That's what's causing your anxiety. Maybe. But to assume that and to treat somebody like that, it makes them feel horrible because they don't see what they're doing clearly. They don't see it as a choice, and their body certainly isn't allowing them to choose whether to have a panic attack over trauma or not. Right. However, as you hold that as an option, right, you and I would work and go, okay, let's hypothesize if that's true. In the back of my head, I'm going, I don't know. It's to be determined. I'm not going to tell you what your problem is. Mm-hmm. I know there are some options,
But through your story and through me caring about you and loving on you, like that's going to be revealed. And then because I've built this bridge between you and I, it's a little easier for me to say, hey, look, I don't want you to feel ashamed about taking this medication. You need it. But at the end of the day, you need it because of this experience you had when you were 3 or this experience you had when you were 5. And then you participated in that lie, which makes you more anxious. Does that make sense?
Yeah. Like you hit on this. It's not something that I would just bluntly point out, in a first meeting. But once we talk through it and we build a relationship, we start talking about working on those things.
Mm-hmm. And how do you feel like that's going so far? Are you enjoying it? Like, do you feel like, because you've been at it now for a few months, what have you seen has been like validating and like, okay, yeah, this is true. This is, because there's a big difference between hypothesizing about this and then actually practicing it.
How do I feel that it's going just overall? Yeah. It feels pretty good. I feel really blessed that the practice is growing, I think at a good rate. And it feels good sitting with clients that feels normal and natural and like what I'm meant to be doing. Mm-hmm. I've done more medication management than counseling so far. I kind of work it in here and there, like within a session, but most of my clients are already seeing counselors.
Sure.
And then I do have a handful of clients who I'm seeing like over and over for counseling, and that feels good too. Mm-hmm. To just get to sit with them and point them back to God and help them.
That's good. How do you feel like that has, in a personal way with your faith, how do you see, even just in the few sessions, God working in that, in you and your clients?
I mean, I had anxiety and doubts, up until starting, just mm-hmm. thinking like, oh, am I really meant to do this? Yeah. Even though I had so many affirmations to look back on my life and where God showed up every step of the way through school and just making it happen. I had anxiety up until I started. Mm-hmm. But God has been so faithful, providing clients, like the right clients who are meant to come see me. Mm-hmm. And when I'm in the room, all of that fades away. Yeah. It's going really well.
That's awesome. Well, isn't that so sweet, that God, in spite of our doubt, in spite of our fear, stepping out and doing the thing that, you're called to do, unlike our trauma, validates the actual truth about who you are. Yeah. And that's the thing I would just, encourage you and tell you is like, I'm going to keep telling you this every week, but you're needed. Like there are very few people, especially from a clinical perspective, and this is what I tell people listening, if you're out there and you need medication, you're struggling with mental and emotional health stuff, spiritual health stuff, it's all related and tied together. And there's not that many people out of the thousands of people treating that have the perspective that you do, Kayla. And that's scary, but it's the reality, which is why we're in such a mess as a society and a culture and a church, is we need more people integrating, the science that God has revealed to us and given us. I mean, he loves our bodies. He loves our brains. He cares about our neurology and our anxiety and our cortisol and all those things. He made us. So we have to look at that stuff. But if we leave out the supernatural and the spiritual and the mental, emotional stuff, then we're just putting Band-Aids on bullet holes, like you said earlier. And so just to encourage you, like, allow God's goodness and grace and and what he's showing you in the office to wash all over you, because you're doing an amazing job.
Thank you.
Even though it's nervous to come on a podcast and talk. And
I know.
I mean, everybody hates it. Not everybody is comfortable doing this stuff. And again, it's reasonable to be anxious to come do something new. That's not a mental health disorder to be nervous. Right. To come on a podcast or speak for the first time or do something like, but underneath all of that, right, is our own sense of worth and value and identity. And you want to do and say the right things. And, yep. We all have that. I have it too. I might not look like it, but it's all underneath there. You just got to manage it and tamp it all down. Yeah. And be able to really practice what we preach.
Yeah. Still show up and do what God's calling you to do.
Absolutely. Yeah. If you're not scared a little bit or a little nervous or a little, befuddled by your own, insecurities, like you don't have courage. You only have courage if you're scared of something and you do it anyway.
Right.
If you're not scared of anything and you just walk in and do it, like there's no bravery there. There's no risk. There's no, actual true effort. So, you do hard things and we push through it, and that actually reveals our courage and our bravery and who God's made us to be. So
good.
Yeah. Well, I appreciate you coming on, and I think where we at, Chip? You're good. Okay. Yeah. Any closing thoughts, comments? What would you tell people that are listening, that are out there, that are, struggling and thinking, man, I might need to take some medication. I don't know if I need medication. What should I do?
I'm here. You can call Clint Davis Counseling. We can do like a little phone conversation to see if it would be a good fit for you to come see me. And I have openings.
Yeah, that's great.
I'm here. What else? It's an easy process. It's, simple conversation, get to know you, hear your story, and we'll come up with a plan together.
That's awesome. Don't have to do it by yourself. Well, thank you, Kayla, for coming on. Is it just Kayla Kinnebrew? Is that your Facebook stuff you're posting, this goodness that people are liking, or do you have a? Yeah,
just it's only for work stuff. Yeah. Kayla Kinnebrew.
Okay. And what's your practice called? What's your,
KBK Mental Health.
Nice. All right. Well, thank you guys for listening, and call Kayla if you need something, and call us. God bless. Have a good week.